And then subsequently, we have seen reports cascading around the world, across the world, from different countries, the United Kingdom, the United States, Canada, Fiji, Malaysia, and also Mauritius and elsewhere too, where Indian migrants, whatever the time or climb of migration, from first generation to the third generation migrants, were all having excess risk of heart attacks and early heart attacks. So the question became fairly clear as to the excess risk, but the next question was, is it genetic or is it because of other reasons? Now, we started doing studies through the Indian Council of Medical Research funded studies in India in early 90s, and we started comparing firstly Indians in India with Indians in UK, and also Indians living in urban areas in India and living in rural areas in India to find out what these differences are. We also participated in major international studies like InterHeart, which looked at about 52 populations across 32 countries and also looked at whether common risk factors explain the risk across populations or are there specific risk factors particularly to certain ethnic groups. Now, it is very clear that InterHeart showed that there are 9 risk factors which are common globally to all populations, including to Indians. But the levels at which Indians manifest this risk is different. We actually start expressing our risk much more, in a sense, in a severe form, even at relatively lower levels of risk factors, whether it's blood pressure or whether it is LDL cholesterol or total cholesterol or so. So the question became, is it genetic or is there some other predisposing factor which sort of identifies why these people are at excess risk? And that is getting precipitated by our living habits, which are changing quite rapidly with modernity. So when we looked at it, it was very clear that when you compare Indians living in the UK, for example, with Afro-Caribbeans and white Caucasians living in UK, things like diabetes, fairly high deposition of fat in the abdomen, and either what's called insulin resistance, and certain abnormalities in the fat, like low levels of the protective HDL cholesterol, these and high levels of triglycerides, these appear to be particularly common among Indians. But when we started looking at urban and rural comparisons in India, then it became very clear that the conventional risk factors like high blood pressure and smoking, obesity, and high levels of serum cholesterol, they appear to explain the risk between urban and rural Indians. Indeed, we also did a factory study in which we looked at factory workers in big cities of India who had migrated recently in 5 years or slightly earlier to urban areas and compared them with their siblings who had stayed back in rural areas. And